As a physician, I'm commonly asked about sleep problems in autism. Here are 5 things I want you to know. After I cover these 5 things, I'm also going to give you a down and dirty, under the table, quick look at melatonin, how it's dosed, and if it's safe. Number 1, sleep problems in autism are common. Current research demonstrates that anywhere from 50 to 80% of people with an autism spectrum disorder have sleep difficulties. So if you're watching this video and wondering if you're alone, let me tell you, you're not. Number 2, sleep problems in autism can vary. They vary widely between individuals, but there are several themes to consider. First, and by far the most common, are difficulties initiating or sustaining sleep. Raise your hand or put a comment below if this is you. So many kids that I see in the clinic every single day don't fall asleep. Some of them will fall asleep for a little bit, and then they don't maintain sleep, and they wake up. They wake up at 2 or 3 in the morning, and they try to go to Come and Go, or Casey's, or Quick Trip to get a big gulp. But one thing is for certain, they are not asleep. A second thing that's very common when it comes to sleep problems is frequent and prolonged night waking. Sometimes they'll go back to bed. Sometimes they were up for hours before they go back to bed. And so then they get up for the school day and they're exhausted. And so, by the way, are you. Next on the list is early morning waking. I have seen this thousands of times. Kids will go to bed at 7 or 8 or 9 and they will sleep until 2 in the morning and then they get up for the day. They're up for the day. And guess who else has to be up for the day in many instances? You do. And another very common problem are individuals that struggle with an irregularity in their sleep-wake cycle. They might come home after school and fall asleep, no matter what you can do. You're giving them snacks, you're letting them watch the iPad, you're prying over their eyes, you're jumping on jumping jacks, you're dumping on the trampoline, you're pouring water on their face. It does not matter. They just do this. These kids are out. They're sawing logs. You're like moving a dead body. They'll sleep for 3 or 4 hours and then they'll get up and they'll party rock until 1 or 2 in the morning and then they'll want to go back to sleep. That is an example of a remarkably irregular sleep-wake cycle. Number 3, sleep problems in individuals with autism have many causes. First and foremost, brain regions implicated in the development of autism also are responsible for regulating the neurotransmitters that regulate the circadian rhythm. This is the rhythm of life that helps you fall asleep and stay asleep. There's also irregularities in the sleep architecture, and this is discovered when you do a sleep study. The reason why I don't do sleep studies on many of these kids is because they're just not going to tolerate it. You go to a place that's not your house, you lay in a bed that's not your bed, and they put a series of little sticky electrodes all over your head. And then they wait for you to fall asleep so that they can determine if there's an irregularity in the sleep architecture. Common abnormalities on sleep studies include prolonged sleep onset latency. Essentially what that means is, as we've discussed earlier, it takes the child forever to fall asleep. We also see reduced total time in a restful state. So children with autism, even when they look like they're consolidating sleep throughout the night, often are sleeping less than their typically developing peers. Children with autism have also been shown to have decreased sleep efficiency, which means the percentage of time that they're in their bed versus the percentage of time that they actually sleep is greatly diminished. And lastly, there's irregularities in the amount of time that a child with autism spends in random eye movement or REM sleep. All these things work together to create a scenario where children with autism, even when they look like they're sleeping, very likely are not nearly as rested as you would think. Number 4, sleep problems in individuals with autism have very real consequences. Of course, if you're watching this, you already understand that. Depriving people of sleep means that terrible things start to happen. Sleep is when your body begins to conserve and store energy. Think about it like being plugged into the wall. Sleep is also a time when your body repairs itself and recovers from the work of the day. And lastly, sleep serves to allow the brain to click into what we're going to call maintenance mode. Think about a librarian that has to reshelf books every day. The brain takes lessons that have been learned in the day and it organizes them in such a manner that they can be found and pulled upon in the future, essentially solidifying learning. This is why the amount of sleep that children get on a daily basis is such an important topic to discuss. Children from ages 1 to 5 need anywhere from 12 to 14 hours of sleep a day, and that does include naps. Children 6 to 12 require anywhere from 9 to 12 hours of sleep. Individuals from age 13 to age 18 require anywhere from 8 to 10 hours of sleep, and adults will typically require 7 to 8 hours of sleep. As you can guess, when individuals are deprived of sleep and they're already up against neurodevelopmental hurdles, this type of situation has dramatic impact on a child's health and well-being. Aggression goes up, self-injury goes up, anxiety goes up, ADHD symptoms go up, and repetitive behaviors go up. Meanwhile, social and emotional reciprocity goes down along with parental functioning. One of the many reasons that I focus on sleep first often after a new diagnosis of an autism spectrum disorder is because if we can solidify sleep, if we can consolidate a time overnight when the body is resting, it's being plugged in, and the brain is healing and cataloging its memories and building on learned skills, that is the quickest way that I can bring value to a family who's often in crisis due to the sheer fact they're exhausted. Number 5, if your child is struggling with sleep, what I want you to understand is that it doesn't have to be this way. There are steps to take, which is why sleep is always mission critical. Yes, we care about self-injury. Yes, we care about rigidity and transition problems. Yes, we care about focus and attention. But the first thing I will do in a clinic is talk to a family about sleep, because that's something that we could potentially make better quickly. And by doing so, it opens the door to receive all kinds of new therapies and services in a way where the child is able to demonstrate anticipated progress, where the repetitive behaviors go down, where the hyperactive and impulsive features improve, where the self-injury diminishes, and the child is available, awake, alert, and present to learn. In our next video, we're going to be talking about behavioral approaches that you can put in place right away to help change the sleep economy in your home and send a very different message to your child, while simultaneously stopping yourself from reinforcing the very behavior that's making you so tired you can't even watch the rest of this video. In addition to behavioral approaches, in subsequent videos, we're going to be talking about the medical approach to sleep-related difficulties. Does your child have restless leg syndrome? Do they have obstructive sleep apnea? Who do they need to see? When should they get a sleep study? Are there medications? If so, what kind? Are they safe? That's what we're going to talk about in the future. So, if there's any value so far, like and subscribe so when those videos pop out, you can be the first to know. Now let's get to the bonus material. Thank you for your continued support and attention. Let's talk about melatonin. Melatonin is a substance that's created from an enzymatic reaction in the pineal gland inside the brain. So what am I saying? It comes from you. The body makes melatonin. And for what purpose? To help individuals begin the process of initiating sleep. Melatonin and its production in the pineal gland is very sensitive and perceptive to light. So as the days get longer, the melatonin starts to show up in your system later in the day. As the days get shorter, melatonin starts to show up earlier, sending a message to your body that it's time to land the plane. This is why you can't be on your phone or watching TV or a movie and having lights flash in your eyes, because it messes with melatonin. Your body says, whoa, 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 are we going to bed? Are we staying up? Like, that is one of the many reasons why screen time at bedtime is such a terrible idea. But recently, the question of melatonin and its safety has been brought to the forefront. You don't have to spend much time on YouTube or on the internet to know that there are significant questions in regards to the safety and efficacy of this medication. What you need to understand is that the use of melatonin in a short-term situation has been proven to be both safe and effective as it relates to individuals with an autism spectrum disorder. What you need to understand is that in the short term, as we've said, anywhere from a 2 milligram dose to a 10 milligram dose. 2 to 10 has been proven to be very effective and safe, both in a short-acting version and in a long-acting version. How should you know the difference? If your child struggles with sleep onset, it is safe to give anywhere from a 2 milligram to a 10 milligram dose of immediate acting melatonin 30 to 60 minutes before bed. What I did not say is keep that individual on that for 7 to 10 years, okay? That is where the question comes up. But what you need to understand is there aren't any long-term studies to tell us the safety and efficacy of using it in that manner. Now, have there been case reports? Have there been people in the literature who've taken these medications for 7 to 10 years? Yes, there have, and they are doing fine. Living fine, no specific complaints or concerns, but there's not enough information for us to generalize that specific information to the masses or the public. So you need to understand that in the short term, melatonin is safe. And if you're watching this, somebody's already brought it up to you. You've already tried it. What are the mistakes people make? They go way too high. You go way too high. There's no data to suggest that going past the 10 milligram dose is a good idea. If your child struggles with sleep onset, use an immediate acting dose to help your child initiate sleep quickly, and then the theory is once they're asleep, they stay asleep. If your child struggles with sleep maintenance, then you might want to examine a long-acting melatonin. Same dosing strategy, same parameters, 2 milligrams to 10 milligrams. We always recommend to seek a prescription from your physician so that way we can regulate the amount of melatonin that your child is actually receiving. If you order it off the internet, if you walk into a drugstore, it's possible that what it says on the bottle is not actually what you're getting. So if we want to be as safe as possible, we have to stay within the 2 to 10 milligram dosing range. We have to decide if it's a short-acting melatonin for kids who can't fall asleep versus a long-acting melatonin for kids who can't stay asleep. And we need to seek the support, counsel, guidance, and prescription of your primary care provider in order to ensure that what it says on the bottle is actually what you get. There is going to be another video in the very near future where we are going to take a much deeper dive into melatonin. But for now, thank you for watching, and I'll see you in the next video.